though there's a huge difference. So we'll attest to what I'm gonna say because this is the most excruciatingly painful episode that happens most especially among males.
Good day everyone. For today's discussion, I'm Cyrus C. Cayabian.
And I am Therese Villaveleda.
And we'll be discussing a common yet often misunderstood condition, which is the gout. So the purpose of this interview is to gain better understanding about this condition, what gout really is, the causes, the symptoms, and how it can be managed or prevented. Yay! So we hope that through this discussion, we can raise awareness and help everyone better understand about this condition. We are joined by a medical expert
To share a professional insight. So we are honored to have with us Dr. Julie Liu. So thank you very much for joining us for today.
Sure.
Thank you po. So
we have prepared 5 interviews questions and some follow-up questions po. So for our first question po, can you explain what gout really is and what exactly the causes and the symptoms of it po?
Gout is actually a metabolic condition. So it means it's something like excess of uric acid. So once the uric acid reaches a certain saturation level, so the crystals actually deposit and cause what we call the gouty arthritis. So basically, it really depends on how your body process breakdown of your proteins and other amino acids, thereby contributing to uric acid level of the individual. So once the uric acid level of the individual exceeds, we call that at least 6.8 milligrams per deciliter, so that means that's the level that it reaches already the saturation level. Therefore, excess of which will deposit and cause what you call the gouty arthritis.
for the follow-up question lang po, you mentioned earlier po na gout is a type of arthritis. So what is the difference po of gout from other types of arthritis?
Though there's a huge difference. So I'm pretty sure patients who already experienced flare of gout will attest to what I'm gonna say because this is the most excruciatingly painful episode that happens most especially among males. It's different from the more common forms of arthritis, which includes your osteoarthritis and some other, they are not really arthritis but soft tissue disorders. So osteoarthritis is mostly a disease where cartilage degenerates. It usually afflicts much older individuals. Gout, on the other hand, afflicts younger individuals, most especially males. It usually starts off as a recurrent or episodic or paulit-ulit na pamamaga or even swelling in the joints. So these joints can include, of course, your big toe. We call that podagra. Other areas can also include the ankle joints, the knees, the elbows. So it really doesn't, though you have a predilection where gout will usually flare. Usually yan, ankles, okay, big toes, knees, but it doesn't mean they're just confined to these areas. So patients usually will complain of recurrent. So in between attacks, they are symptom-free. When I say symptom-free, they don't feel anything. But once they feel or they felt the flare that's coming in, at least in the textbooks and even testimonies of some patients with gout, they would say this is the most painful episode of joint pain and swelling. Whereby just walking already they cannot walk, okay, because of the painful episode. Even the feeling of blankets that covers the affected area, it's so painful that they cannot bear the weight of blankets or even other light materials over covering that affected area. So the natural course of gout, most especially during the early phase, it's self-limiting. When I say it's self-limiting, it just wears off naturally. Usually within 3 to 5 or even 7 days, it will just go away. But the problem is it's because of the excruciatingly painful episode that they will require some pain relievers. Okay? In between, so once natapos na yung flare, after 3 to 5 or even 7 days, it's as if nothing happened. They go along or their activities of daily living, they just perform all their activities of daily living until the next episode sets in.
For our second question po, how is gout diagnosed in a clinical setting po?
There's a gold standard in the diagnosis of gout. So we look for crystals of, we call that MSU crystals or monosodium urate crystals under a special microscope. We call that polarizing microscope. So we get fluid, okay, at least we aspirate fluid out of any of the joints. Most common will be the knee because it's a larger area. So once we tap the knee, we get the fluid out, we examine the fluid under a special microscope. We try to appreciate the presence of beautiful crystals of MSU. So they shine differently. They have a special configuration when you look at them or you look for them under polarizing microscope. So once we see the special characteristic of MSU crystals, then no doubt, that's already found. Okay? Now, in the absence of special microscope, can we still give a clinical diagnosis of gout? Yes, we still can. How do we do it? We need to talk to the patient. We dig through their history. Usually, patients will come in the clinic because of an acute episode of gout, because of an acute joint pain or swelling. But during the conversation, when we talk to them, we dig into their history, they will admit somehow that they already have been having recurrent episodes of similar attacks of gout even years ago. So the mere fact that we are able to get that in the history, number 2, they're males. Number 3, they are alcoholic drinkers. So they drink lots of alcohol. Number 4, they're kind of they have a special build or they're stocky or obese or heavy. Occasionally, it runs also in the family history. And they are young males, Asians, Filipinos. There's a lot of Filipinos with gout. So we used to think gout only happens in those affluent individuals. In literature, you will see those Roman gods and who because of their affluent status in the society, they binge into different forms of alcoholic beverages, di ba? So we thought in the past, centuries back, gout only afflicts those in the social strata, high social strata people. But in the past couple of, I would say, not only years but decades, even those ordinary citizens. The reason why? Because of the because of the use of alcohol. Yes. So alcohol plays a huge factor. Other than that, inherently, there are patients who cannot by themselves handle certain uric acid load because of some kidney problem or issues. Then these are also kinds of individuals who can be afflicted with gout.
Thank you po. So, for the next question, meron po kasi mga preconceptions or mga myths about the condition. So, can you please clarify po if some of that are true? Katulad po ng mga yung eating beans or nuts. So, magkakaroon po ba ay isa sa mga factor or it's just like a myth?
Well, there are fallacies more than facts. Okay. So, whenever a patient with gout asks us, or at least tells us that, oh, the night before I ate this one, and they are pretty sure all of these different dishes actually caused their flare, then we try to tell them not all patients will react the same way as what he reacted or he reacted to the certain dish. So meaning, it takes tons, kilos of whatever you're taking that will contribute to increase in your uric acid level. Okay. Having said that, we always tell patients, if and when you so observe, so after eating a certain dish or a certain form of diet, the following day, you're pretty sure that what you took the night before was the culprit in the causation of your acute arthritis, then you just avoid it. We don't give a general statement that you need to avoid or you should not be taking this one. So taking beans, legumes, certain forms of fish, not all of this, we don't give that as a general recommendation to avoid from.
Okay, thank you.
For follow-up question lang po, based on your experience po yun naman, mga how many patients or cases po yung na-handle niyo?
Gout.
Yes po.
It varies because it's not seasonal. Okay? So it's not like the flu season, diba? So for patients with gout, pretty much it's mostly they come in sporadically. So meaning, as I said, hindi naman siya seasonal. Patients with gout know that they have gout already. So meaning, it's basically because they can't control their lifestyle. They don't take medications. They just are carefree. Then they just walk into the clinic most of the time because they have the acute onset of the gout flare. Of course, we also see patients naman na who were already, I would say, learn from the past experience and they don't want to experience the same condition. That's why they regularly follow up. So, iba-iba ang profile ng patients.
So for the next question po, what are your recommended treatments or management options for gout?
So number one, non-pharmacologic first. Non-pharmacologic management will be avoid alcohol. That's the number one rule. Avoid alcohol, avoid too much sweets or those fructose-containing beverages because it has something, it can affect your kidney somehow. It really depends on the load of sucrose and fructose that you bring into your system. Lifestyle change is very, very important. For patients who might be on the heavy side, try to really work it out, lose weight, control whatever you're taking. For gout patients, we always tell them you can eat anything, provided you felt that once you take this kind of a dish, you will have a flare, then avoid it. But there's nothing, no definite recommendation on what to avoid. That's one. That's for the non-pharmacologic. So it's basically lifestyle change. Take in as much water as you can. Water, and it's not any form of beverage, not any sweetened beverages. For the pharmacologic part, it really depends on, there are some drugs, well, these are established urate lowering drugs that we call them. However, there are some patients who might have inherent or who might have problems developing some kind of an hypersensitivity reaction or worse, a life-threatening reaction to certain drugs. So once we are convinced we have already established the diagnosis of gout, then we have to educate the patient that they have to be kept on certain medications. We call them the urate-lowering drugs in order to prevent the constant build-up of the uric acid in the body. So we want to ensure that we keep a certain target level. We call that treat to target level of uric acid for someone with established gout. So kung established na meron siyang gout, we have to make sure that their uric acid level is less than 6 milligrams per deciliter. So in order to achieve that 6 milligrams per deciliter, kailangan talaga nilang uminom ng gamot. And these drugs is not a one-time, big-time thing. So meaning, once we start a patient on uric-lowering drug, we start them low and go slow. So we closely monitor how their body respond or how their body reacts to these medications. So if and when there's no side effects that happen along the way, then they have to closely monitor their uric acid level with a constant follow-up in order for us to adjust the medications.
For the last question naman po. So what are your advices? What are your advice that would you like to share with the individuals who are currently experiencing gout, or people who want to prevent it from developing?
Well, a lot of gout patients, number one, a lot of gout patients take medications on their own. So meaning, oh, I heard this from my compare, from my dad, from my brother, or whoever out there, saying that they took this medication because they feel that they have a similar problem. That in itself is already a no-no. Because individuals, of course, vary. It really depends on how the uniqueness of the individual. Okay? So not even 10 gout patients, they will respond the same way as we expect them to respond. So that's one. Well, it's good that you have heard maybe of someone who might have a similar problem as you. But it doesn't mean you need or your body will be accepting or will be processing the same drug given to your whoever out there, that you will not be reacting as well. That's one. Number two, it takes a lot of patience and commitment and acceptance that once pag sinabi nating alcohol should be avoided, it's a little challenge to us as clinicians, encouraging patients to really commit themselves in avoiding or even stopping intake of alcohol beverages. Number three, as I mentioned a while ago, commitment. So when I say commitment, they're committed to really follow strictly what they should avoid, what they need to take, and what they have to do as a patient, that they have to follow up with their general care physicians or doctors or even specialists to avoid what we call the chronic tophaceous gout. You know, gout when it's left untreated, left unrecognized, further on, it can potentially damage the joints, leading to chronic tophaceous gout. You will be seeing patients who might have stones depositing in their joints or anywhere in the body, because these are patients who have not received any form of treatment for several years. So it's a cumulative side effects already of untreated gout. So once the gout is left untreated, they tend to develop, we call that a chronic tophaceous gout, and we need to inform patients. Once they develop chronic tophaceous gout, it really depends on where those tophi deposit. Once they deposit in certain areas like soles of the feet or dorsum of the feet, that they will have difficulty wearing shoes or doing their daily activities, don't outright resort to surgery. So meaning, yes, there might be certain patients or indications when surgery is needed. But once patients undergo surgical debridement or excision or removal of those tophi, the patients have to understand they still need medication. Kasi once they have it surgically removed, the tophi will redeposit in where it was removed. Without any further treatment, That's the consequence of surgical removal. Patience, commitment, and understanding on the different phases or the different stages of the disease will make them realize that gout is easily treated provided lang merong patience ang pasyente. So they need to know who to look for and what to avoid, and constant follow-up and close monitoring.
Clarifications lang po based on what you said earlier. Does that mean po na every individual po na may gout, nakadepende din po kung ano yung type of medicine na ipaprescribe sa kanila? Like,
Well, we know certain drugs work, but it doesn't mean certain drugs work. The uric lowering drugs really work. It's just that we need to identify each patient is unique. So meaning, pwedeng mag-react ang patient 1 compared to patient 2 compared to patient 3. So hindi rin ganun kabilis, or at least somehow their response to the treatment will be different on all patients. But definitely with a constant follow-up and education and knowing what things to watch out for, will we be able to control gouty arthritis.
Last na po talaga na follow-up questions. For example po, ako, kunyari may gout po ako and may other diseases po ako. Possible po ba yung ititake ko po na treatment is makaka-affect din po sa, kunyari po, yung sakit ko po, may hypertension or whatever po ako na disease, yung ini-intake ko po na gamot doon, pwede din po ba maka-affect sa gout ko po?
Okay, definitely. Well, number 1, don't worry. You will not develop gout at this stage. We don't expect gout in pre-menopausal women. Okay? So, very, very few rare instances where gout is seen in young women. Gout is seen in men. Okay. So, number 2, yes, may tinatawag tayong drug-to-drug interaction. So, meaning, not all drugs will be safe to take together. So, it takes a lot of education to the patients. Number 3, there are certain drugs that can cause flare of gout. Pwede din yan. Number 4, there are also certain drugs that can help, not the primary purpose of lowering the uric acid, but it can help also lower uric acid level. So, iba-ibang drugs will serve differently. It can help lower uric acid. Some drugs can cause flare of uric acid conditions, and even drug-to-drug interactions. So it's not uncommon. So we need to also make sure, that's why whenever patients come see us, we get also their medical history as well as their medications in order to ascertain that yung drug-to-drug interaction will be lesser and not cause any life-threatening interactions.
Listen, so everyone, that concludes our interview for today. We hope that through this discussion, you've gained a better understanding of gout and the importance of daily awareness and proper management. Thank you very much.
Thank you very much for this invitation.